Okay, recording.
Hello everybody. Today we are here to talk to you about breast cancer. Breast cancer is the commonest cancer in women in any age group, in any race, and in any part of the world. It is the number one cancer among women in Malaysia and worldwide. In Malaysia, the incidence is 1 in 19, and in the US, the ratio is 1 in 8. But don't forget, breast cancer can also occur in men, but less common. As I mentioned earlier, it is the number one cancer in women. It can occur at any age group, any race, and any religion. The commonest age group is 40 to 49, but now breast cancer is becoming more common in the younger age group. We have patients in their 20s with breast cancer. We have patients in their 80s with breast cancer. So breast cancer can occur at any age group. The incidence of breast cancer is increasing. Thus, we need to be more aware. We need to know more about this disease, and we need to know the treatment that is available for us. Now, the main message here is that early detection is the key to cure. If you come early, the rate of cure is high. If you come at stage 1 or stage 0, the percentage of cure is almost 98%. But if the cancer is diagnosed late, then the rate of cure is also reduced. Now, thus, we need to have more awareness program, because people need to know that breast cancer is treatable, and there's a lot of simple treatment that is available now. Before I go on, we need to know what are the signs and symptoms of breast cancer. So firstly, breast cancer can present as a lump, or as discharge from the nipple, or as a lump under your armpit. Now, most of the patients, about 60% of patients, present with a lump that is painless, no pain. That's why breast cancer is known as a silent killer. Now, what we must remember is that not all lumps in the breast are cancer, but we must know, if we detect a lump in the breast, we must seek help. We must go and investigate and make sure it is not a cancer. There are benign breast lumps such as breast cysts or fibroadenoma, but you will not be able to diagnose this unless you go and seek medical treatment. Now, once you have been identified with a breast lump, the doctor will then send you for some imaging. You can either do a mammogram or an ultrasound depending on the age group. Now, if on the ultrasound or the mammogram it is detected that there is something suspicious, then you will be advised for a biopsy. A biopsy can be either fine needle or a true card biopsy. This is how breast cancer is diagnosed. It is actually a triple assessment where you examine the patient, you do some imaging, and then a biopsy. Now, once a patient has been diagnosed with breast cancer, then she has to undergo a lot of counseling, and treatment is then offered to her. Treatment can either be a lumpectomy, which is a breast conservative surgery, or a mastectomy. Now, all this depends again on the patient's age, the size of the lump, the site of the lump, and of course the patient's choice. It is a decision made between the patient and the doctor. Now, after surgery, they will get a report to say what stage of cancer the patient is in, and then the patient will be advised for either chemotherapy, radiotherapy, or hormonal therapy. So the most important message here is that early detection is the key to cure. So don't be afraid. Come forward, come and detect any lump that you feel. Come and make sure it is not a cancer. And even if it is a cancer, come early so that you can be cured of this disease. Now, one of the methods to detect cancer early is what we call as breast screening. Screening actually reduces the mortality from breast cancer, and when I mean screening, means self-breast examination plus go for your routine mammogram or ultrasound. Now, self-breast examination can be done at home. Learn how to do it. It is fairly easy. It only takes around 10 minutes. You just have to examine your breast by yourself, and if you detect anything abnormal, please go and seek help. It should be done by everyone, everybody, men and women at any age group, and you should do it monthly, at least once a month. And those who are in menopausal or pregnant, if you don't have your periods, you do it, maybe you pick a day in the month. Those who have the menstrual period, you do it 7 to 10 days after the period. So by doing breast screening, you will then pick up something abnormal. Then don't stay at home. Go to your nearest doctor, go to your family doctor and get it checked out. So in conclusion, again, breast cancer is the #1 cancer killer among women in Malaysia. So we need to be aware of this disease. We need to learn more about it, and we need to seek help early, because, as again I will say, early detection is the key to cure. Thank you.